Hello, I'm Brian Haug, President of the American Journal of Managed Care.
And I'm Justin Gallagher, Associate Publisher.
Welcome to This Week in Managed Care from the Managed Markets News Network.
Our top story comes from CMS, which this week released its third annual round of Medicare data, providing insight into how hospitals spent $62 billion in 2013. Also released were details on $90 billion paid to providers and suppliers, and, for the first time, information on which prescriptions were the most popular in Medicare Part D. To access the latest CMS data, visit cms.gov.
CMS Acting Administrator Andy Slavitt also announced a plan to give entrepreneurs access to Medicare claims data, which can be used to create products and software for value-based billing systems. In the past, Medicare claims data were off-limits to any potential for-profit venture. Today's announcement is aimed directly at shaking up healthcare innovation and setting a new standard for data transparency, said Slavitt.
Topics from defining value in cancer care to the promise of new biomarkers in immune-oncology gained notice last weekend in Chicago as the American Society of Clinical Oncology held its annual meeting. At a session that took stock of ASCO's year-long value initiative, Dr. Neil Maripal of Case Western Reserve University said patients tell him their cost concerns include copayments, the cost of travel, and whether their insurance will cover the best drugs available. Oncologists can no longer be blind to the reality of costs for their patients, he said. Oncologists cannot be the gatekeepers on cost. Rather, we have the opportunity to be the gatekeepers based on value. Important clinical news came from Johns Hopkins. Dr. Luis Diaz reported on patients with high mutational burden with mismatch repair who responded to checkpoint inhibition of PD-1.
Patients with high mutational burden with mismatch repair, which represent about 3 to 5% of advanced colon cancers, responded very well to checkpoint inhibition with anti-PD-1. My suspicion is that this will become standard of care in the near future for colon cancer, and that will demand that mismatch repair testing is part of the standard care for those patients.
The cost of specialty medications, along with the rise of claims from the newly insured, are being cited around the country as payers seek rate increases for 2016. Blue Cross Blue Shield will file for hikes of 20% or more in several states, although many expect regulators to push back on those requests. How did so many insurers miss the mark? 2015 is the first year they have full claims data for new enrollees under the ACA. But Catherine Murphy-Barron, Vice President with the American Academy of Actuaries, said some health insurers priced themselves below the competition and now need rate hikes to cover the cost they see coming through in claims.
Finally, this week, the American Journal of Managed Care travels to Boston for their 75th scientific sessions of the American Diabetes Association. Our coverage starts today and will include highlights from the TICOS trial, which evaluated cardiovascular outcomes with sitagliptin. This trial will be important for every therapy in the DPP-4 class. At our recent conference, Patient-Centered Diabetes Care, Dr. Om Ganda of Joslin Diabetes Center discussed why it is important for patients to receive the right therapy.
When it comes to treating patients with lipid problems, not only they should receive adequate nutritional therapy, but the nutrition therapy and lifestyle changes are not enough. They should be given appropriate pharmacological therapy. We have now drugs that are proven to reduce the risk for cardiovascular disease with very little adverse events. So we have to give all of our patients with high risk for cardiovascular disease the advantage of those drugs. And some of the new guidelines mandate that patients with diabetes, once they are above the age of 40 for sure, they should all be treated with drug therapy because lifestyle changes are usually not enough to reach adequate reduction in the LDL cholesterol.
You can follow our coverage of the ADA at ajmc.com.
For the American Journal of Managed Care, I'm Brian Haug.
And I'm Justin Gallagher.
Thank you for joining us.